Hello friends, this is your friendly neighborhood pediatrician Dr. Aditya Bhatt, and today we'll discuss a bit about bacterial endocarditis. So as you know that bacterial endocarditis is one of the most common cause of infective endocarditis, and usually the vegetation of the endocarditis is usually present on the opposite side of the flow of the shunt. This is a common MCQ asked. So example that if we take PDA, then the vegetation is usually present on the pulmonary side, and if we take VSD, the vegetation is normally present on the RV side of the VSD. Now the when we go to clinical features, one of the most common clinical feature is fever. Fever has to invariably be present in patients with endocarditis without presence of fever is very rare or nearly impossible. So, and there is weakness, headache, dyspnea and cough. Now there are many manifestations and end organ manifestations of endocarditis. As you all know, there are vascular phenomenons of arterial emboli or pulmonary infarcts, mycotic aneurysm. Please comment down below the most common cause of mycotic aneurysm, and intracranial hemorrhage and Janne's lesion, which is painless, is a vascular phenomenon. And there are immunologic phenomenons like Osler's node and Roth spots in the eye. Now there are other complications also, and one of the most common complications that we tend to forget are splenic infarcts. Now, usually endocarditis prophylaxis drugs are given in patients. As you might have heard, before procedures we give endocarditis prophylaxis. So the most common drug used for endocarditis prophylaxis is amoxicillin, and if there is allergy, we prefer clindamycin. There are other MCQ asked are what are the causes of culture negative endocarditis. So for culture negative endocarditis, usually the organisms are HACEK organism, HACEK. And please comment down below the full form of all the organisms consisting of the HACEK group. The other bacteria which are culture negative are Brucella, Coxiella, Bartonella, Chlamydia, Mycoplasma, and Trophirema vipili. Trophirema vipili, as you all know, causes Whipple's disease. Now, usually we used modified Duke classification for diagnosis of infective endocarditis. So the major criteria has two things. One is a blood culture positivity. Now, blood culture more than or equal to two blood cultures should be positive, at least 12 hours apart. Or if you take 1 hour apart, then you need three positive blood cultures. And the other major criteria is echocardiographic criteria, which shows intracardiac oscillatory mass or myocardial abscess or valve dehiscence. Now, minor criteria include fever, predisposing heart disease or vascular phenomenon, immunological phenomenon, and positive blood culture, which do not fulfill the major criteria. Now, the only exception to the major criteria requiring two positive blood CS are the Q fever or the, as you all know, Bartonella. Bartonella requires only one positive blood culture. Now, one of the other MCQ asked is that if there is biofilm associated Staphylococcus aureus, we prefer rifampicin along with vancomycin because biofilm penetration is very good for rifampicin. I hope that's all. I hope that was a good session, and that's all for today. And thank you so much for watching. Please like, share, and subscribe.